getting an overall feel for it. He's complaining of upper back and low back stuff here, along with knee and foot. But what we want to look at first is let's look at the overall contour. Now, when we look at the overall contour, we have a little bit of dishing in the spine here, in this area. It goes in, so he probably has some damage in here. This is where it started from. Here you can see the spinous processes. And you can see the spine does from here, curves like this, like this. You follow, you feel my finger?
Mm-hmm.
So there's some curvature going on here in the spine. Okay? Head down, please. There you go. And it looks like that's where it's starting from. You work for somebody, you work for yourself?
I work for myself and for somebody.
Good. So we're getting a big pressure reading at the base of the neck here. Upper neck is good, still there. C7. Your sleep is okay? Your digestion is okay? You sleep okay?
I sleep like probably 6 hours.
Okay. Now, whenever you've had these pains, what have you done for it to make it feel better? Excuse me.
Nothing.
Nothing? Deal with it?
Yeah.
No hielo?
No, my brother, it's worse.
Your brother is worse?
Yeah, he can't wait. Sometimes he can't wake up.
That's not good, man.
Mm-hmm.
So the idea is you got to be at your optimal best so you can work and play as hard as you want, you know?
Yeah.
So we're definitely also getting a big reading down at the base of the spine. Remember I was telling you in the tailbone area?
Mm-hmm.
Yeah. Here, here, and here. Those are the three big readings I'm getting. And let's just run the fingers. And what you can start to see here is the tissue changes start in this area around T5. Keep going, orange peel, and it's right about here. Now, when I'm feeling in here, is this hurt more or this one? That one
Mm-hmm.
or this one?
Mm-hmm.
The first one?
Mm-hmm.
Okay. But not this one.
Mm-hmm.
Okay. Right there. That's the one. 1, 2, 3, 4, 5, 6. So it's around 7, 8. Sit up straight. 9. Okay, this is 10. This is 9. This is 8. This is 7. So out of all of them, it's starting down here.
Mm-hmm.
Okay? But when I'm pushing, is it more tender to you here or here?
Yeah.
Top one, right? Yeah. Okay. So around 7, 8, T7, T8. So just to confirm. Just making sure. Okay. Scoot forward, please. I'm going to be feeling back here your SI, your sacroiliac joint, your hips. Right side only. Left side only. So when he does the left side, the right is good. But when he does the right, do the right. This wants to go with it. Okay? Scoot back for me, please. Back. Poquito más. Thank you. Sit up a little bit straighter. Does that hurt to sit up? No? Because Mario, you're supposed to sit like this, but your spine won't let it because it wants to be the other way. We need to be like this, okay? Now, what's probably going to happen after your adjustment, it may start to hurt if you start to slouch too much. I'm going to show you a couple of different ways in your daily life that you're going to have to modify some things in your work, okay? I'll show you how to do it. But if you don't do it, 2 things. The adjustments won't hold, and this is going to create issues down the road. So I'm going to show you the things I need you to do for you. Let's go ahead and feel the right joint. This is the top of the joint, This is the middle of the joint. This is the bottom of the joint. It's not so bad. Not a lot of pain. Shouldn't be anything. Little bit here, if anything. Yeah? Tiny bit. On the middle bottom side of the joint. That's not moving down. You feel this here?
Mm-hmm.
Okay. Now, does it hurt? Is it more tender when I push here or here?
Mm-hmm.
I.e.
Yeah.
See. Now, I need you to stand up, please. Let's look at his glutes. You can see the left side is higher and flatter. So this is an ASI and ilium on the left side. Sit down for me, please. I'll explain all of it. And let's feel the sacrum. ¿Duele?
Yeah.
Sí. ¿Mucho duele arriba
Mm.
o abajo? Both?
Yeah.
Okay. So then we go at the bottom. So he's got a sacrum issue, he's got a left pelvis issue, T7, and let's check the neck now. You understand everything I'm finding?
Yeah.
Okay, cool. Sit back for me, please. Head down. Let's feel. You got the day off today?
Yeah.
So not only am I gonna make you do your work better, I'm gonna make your soccer better, okay?
I hope so.
What's that?
I hope so.
I'm going to make it better for you, okay? Ahí?
Well, it does, but
Not like here.
yeah.
Okay. C7, T7, sacrum, left pelvis. Now I want to check the motion in the shoulders. Sit up straight. Let me do the work. Let me do it. Let me do the work. So right side doesn't go as high. Now you see when I'm doing this, it's catching.
Mm-hmm.
You feel that?
Yeah.
That will probably change today after your neck adjustment, okay? You'll see. Both sides, yeah?
Mm-hmm.
So there's a lot of crepitus grinding. There's not a smooth glide of both shoulders. Go on your back. Let me test out your knees and your feet now, sir.
Okay.
Yes, sir. Boca arriba. I mix up Spanish sometimes. I learn when I'm dealing with patients. Sometimes I'll mix it up a little bit, okay?
Okay.
Sometimes Hindi, sometimes Arabic, whatever. Okay? So, first thing, looking at the feet, okay? We can see this heel is higher than this side, number one. Number two, we can see rotation of the tibia. Duele?
Yeah.
Duele, but not as bad as
Yeah.
this side. So, I agree with what you said. You said the injury, there was this. This was compensating. This is a problem because it started with this.
Mm-hmm.
Okay. Now, whatever happened on this, okay, it affected your pelvis, your hip.
Mm-hmm.
And remember, when you look at the hip, so left hip, what goes in here in the hip?
Mm-hmm.
Your femur.
Yeah.
And then the femur connects to tibia, the knee.
Mm-hmm.
So this and this starting, okay? So we gotta look at the posterior tibia on that side, AIN femur on this side. Now, when I push here, duele? Mucho duele derecha, izquierda? Both?
Mm-hmm.
Okay. How about here? Not so bad right now. A little bit here, but mostly at the talus. So bilateral talus issues. Let's go ahead and just check dorsiflexion. So it doesn't want to go up on that side, on the medial side. Let's check the other side. That's there too, but that's not really from the foot. That's coming from up there. Now, you roll these two bones here, right? These two.
Yeah.
These two, you can already see the swelling here on his cuboid, right here. nice, big, and puffy. Let me show you this, please. Excuse me. So this is the foot model. This is a right foot.
Mhm.
So these two fingers or toes, they go to this bone, the cuboid.
Okay.
When you rolled it, this thing popped up. If that pops up, then those two bones don't sit properly. It's always going to be off. That's what you've been feeling. And to avoid the pain, you started compensating on the opposite side. Watch this. So these two to here. Okay? You feel that. Now, it should rock back and forth. It doesn't even go down. Now, compare. Look at this side. You see? The it rocks on an arc. On here it rocks on an arc. Do you feel this? Now watch this. It's not going up and in the same. So we got to work on your ankle and the cuboid here. No problem. Okay. All right. Left pelvis, sacrum, T7, C7. Posterior tibia on the left side, AIN femur on the right side. Bilateral talus, more AS medial tilt on the left side. Superior cuboid. We have to check, we check both shoulders. There's asymmetry of the circumduction. And now let's check your elbows and wrists and we get started. Stand up for me, sir. Stand up and first squeeze my hand. Squeeze, good. And you got power. I like you're not holding back. Good. Squeeze. No, good. Squeeze. And just resist. So you got good power in your hand, but it's weak right here, this bone. Yeah. This, all of this is controlled by the nerve here. It's that nerve here. So do that again. Do that. You can see the double jointedness. Okay? Yeah. This side does it?
No.
So you came in with a poker face today, like you came for poker. You're being very, like nothing's wrong. But there's a lot of little stuff going on. Squeeze. Can you do the same thing here?
No.
Okay. Let's feel the elbow. Now, when you were at the desk doing this, was your neck like this also? How was your head?
Sometimes like this, or just my hands like that.
Just on it, right?
Yes, on it. Or sometimes when I'm driving.
You put it on there and then you have to pop it out.
Like it bothers me. I go like that and it goes in cracks.
And it's fine then.
Yeah.
Okay. So let's go back to the nerve chart, please. Elbow, wrists, all of these nerves come from where? The neck, the base of the neck. And we're getting the pressure at the base of the neck here, C7. Okay? So C7, T7, sacrum. I'm going to do C7 as a PRS. Right hand up, please. Cool. And down. Scoot to the right a little bit more. There you go. Okay. So, and then what we wanted to do immediately after this adjustment is check his range of motion in the shoulders, okay? If we're doing our job correctly, then it should be a little bit better. Good. Now, nice happy place there. There we go. Let that right ear go down. Down. Good. That's a piece of it. It's a little bit. Now, a little bit more. You crack your neck a lot by yourself?
I just move.
Look up. There you go. Gotcha. Sit up straight. Nothing hurt, right?
No.
You okay?
Yeah.
Sit up straight. So that was repositioning the bone. Now, from what we just did there, Mario, let's see. Dígame.
Yeah.
What's different?
It's not going.
You see that?
Yeah.
Okay. Other side. Still a little bit there, though. That one's still there, that one's not. So we'll continue on that. Let's go on the orange table, please. We're gonna do the low back here, okay, first? Nice and easy there. So I'm setting sacrum. We're gonna start the process here. Good. Can I have you bring your chin up, Mario? Home run. I got you. 2, 3, 4, 5, 6, 7. Perfect. From what we just did, walk back and forth. Tell me the difference already.
I feel like if I'm walking
Straighter, right? Good. Keep walking. Good stuff. Walk on your toes, please, up high. That should also feel a little bit better in the toe, right?
Yeah.
Yeah. Walk on your heels, please. Go ahead and have a seat. See, that's already changed the appearance of his spine. When we look at the video, this is already changed. Beautiful. So we had a big reading on the right at C7T1. It's already come down more than half. Well, T7 is clear. Nice. Sacrum is clear. 1 point. Now, when I push on here, that should feel different now, Mario.
Yes.
Correct?
Mm-hmm.
Now, let's motion. Excellent. That already feels better to me. See? I am going to need to work on that pelvis. 7 clear, that's clear, that's clear. Sit up straight for me. I want to work on your left shoulder. Now, what's interesting here, Mario?
Mm-hmm.
It's your left shoulder that's really the problem, not your right. Okay. Drop it down. Elbow down. There you go. Go on your back for me, sir. Now, what I'm going to do is start on the ankle. I'm going to start the process. And the way we're going to do it, I first have to prepare the joint, okay?
Okay.
And if you look at any of the videos that I work on the ankle, I go through and explain a lot more detail. But basically, I got to work the swelling and scar tissue out, okay? We get the scar tissue out and work this properly, then we actually fix it. If we don't do this, we can make some sound, you feel good, it doesn't get fixed though. Same thing, I go a little bit deeper each time. You can handle it. If you can't, you just tell me.
Okay.
But I know you can. Give it to me. Fit this thing here, that's the old scar tissue. And I'm also going to show you things you can do for yourself as well. There we go. So this is working what we call the periarticular swelling. That's the swelling around the joint and the scar tissue. Next, we're going to do passive range of motion and do the intra-articular. Now, I'm going to go a little deeper. There it is. There you go. 3, 2, 1. I'm going to use the board. The board is going to make the sound like that. It's not your ankle. I got to get it started here. There. Nice. There you go. Walk it off. As you're walking, Mario, keep walking. Now, you may get some crackling sounds in your left ankle as I'm breaking up that old scar tissue, but we're also putting it in the right place so it heals properly. Let's say the bone is like this, right? And let's say we sprained it and it misaligned, but it was never put back, so what happens? You get scar tissue in through there. We break that up, we put it back, it heals properly. Keep walking, tell me the difference. Should be less pain.
Yeah.
Can you do a couple of push-ups for me, please? Make sure there's no pain in your upper back when you do that. No pain, right? Okay. Now stay in that position. Come back into this position. Well, and I want you to come up like this and tell me how that feels on your low back. Should feel better. Okay? That's where we're going to start with you today. Last thing I will do is your elbow. Okay? But before we do that, let's test that wrist. Squeeze the wrist hard. Make it do the. Good. Keep going. Good. Okay. Okay. There you go. Give me this thing. Distal radius. There you go. Go like that 5 times. Squeeze my hand hard. Good. Squeeze. Now up. Yeah. Squeeze. Okay, let's retest that left shoulder, please. I'm pretty sure your left, you know, all this stuff going on here, it's actually coming from your upper back. You're going to see some kinking in your spine that I'll explain to you when we get the, yeah. So it's better, but it's still there. This should be way better. Yeah. Okay. Mario, you have any questions for me? That's where we're going to start. Okay?
Okay.
Welcome to the office.
Thank you.
You're welcome.